Welcome to our special in Barbershop Medicine, where today we're going to have a discussion with Dr. Anthony Fauci.
So barbershops traditionally are safe spaces in Black and brown communities. Today we're going to talk about issues related to COVID and the vaccine.
Dr. Fauci, thanks so much for joining us today on this special episode of Barbershop Medicine. We really appreciate it.
I feel like a fanboy.
I know.
Hi, Italo. Hi, Jamie. Nice to meet you guys. You're both in California, right?
That's correct.
We are.
So barbershops in our communities are like safe spaces where we discuss everything. So this is our chance to talk about health and specifically COVID and the vaccine.
Sounds
Yeah,
good.
and one of the questions I have for you is, how often do you get your hair cut?
Right. Hey.
Hey.
That's a really interesting question. I used to get it cut about every 4 to 5 weeks, but when we were in the middle of the big surges where, before vaccination, I pulled it out to like 12 weeks, 13 weeks.
I was going to say that there are a lot of people who became expert barbers at home because of the pandemic.
Yeah,
So,
yeah.
One of the things about the barbershop that we both enjoy is being able to have like a real conversation. And
Right.
and one of the things that we like to do really is use the barbershop as a platform to educate so that people can understand why we say things like go get the vaccine, and they can come to the obvious conclusion that we all came to. So I was wondering, what do you think about that type of messaging and being able to actually teach that communication so people can understand it?
I think that's the way to go. In fact, I just came back about 45 minutes ago from the White House talking with President Biden and him wanting to know why we still are below where we need to be in the African American community. And that's really, as I'm telling you guys things you know inside out. It's so unfortunate because, as I'm sure you're seeing in your practices, African Americans, because of underlying medical conditions, when they do get infected, which they get more often because of the jobs that they generally are in, generally have a greater chance of a severe outcome, hospitalization, and even death. So anything that gets people comfortable in the discussion about why it's important to get vaccinated, to me, that's golden. In fact, that was one of the things we mentioned in the discussion was the whole issue of the barbershop beauty salon where people can come in, they feel they're with their own crowd, their own crew, they can open up, chat and talk. They believe you guys and all of your colleagues a heck of a lot more than when they see a white guy like me in a suit talking to them. Really, seriously.
You did mention that there's this weird gap that we're not able to close. And I'm more so concerned about like those contributing factors. What do you think is really behind this gap in terms of vaccination, the 1.4 times less likely to receive first vaccination that African Americans are demonstrating? Like what do you think is behind it?
I think a bit of it is handed down from generation to generation, an understandable distrust of the federal government / medical / the African American community. And you got to own that. The non-African American community's got to own that. So the one thing that I've learned is you don't want to disrespect the distrust. You got to make sure you say, I understand why you are distrustful. So let's talk a little bit about it and talk about why it's so important in today's circumstances to get vaccinated. So that's lesson for me, number one. Don't put anybody down because they don't trust you, because historically they have a good reason to distrust you.
I'm glad that you said that.
Yeah. One of the things that we find interesting is there's this rumor going around where everybody is saying, and we hear this in the barbershop, that the vaccine is gene therapy. I want to clear that up a little bit so we can explain how these vaccinations work. What do you think about that?
It's understandable, and I think just explaining to people in really plain language that, first of all, it has nothing at all to do with your own genes, period. That's it. It's a message, a code that tells your body to make a protein. And it's particularly good because it's made in the environment of your body making its own protein rather than you injecting a protein. And that may be one of the reasons why the body responds so much better. We never would have imagined it would have been as highly effective as it is. I was praying for a 65, 70, 72% efficacy, and it turned out to be 95% effective. So we just got to make sure they understand, as a matter of fact, nothing at all to do with your genes, nothing at all to do with fertility. That's the other thing that a lot of African American women are concerned about.
I know we were talking about communities of color, but this is across all communities where there's a concern that vaccination may lead to some type of infertility, or the fact that your chances of getting pregnancy may be altered by vaccination, or outcomes could be worse. How do we address that part? Like, how do we create some comfort in that knowledge?
Well, the one thing that we've learned very, very clearly is you counter misinformation and disinformation by continuing to provide the correct information. I mean, that's the only way to do it. It's like the best defense is a good offense. You know, just go right at it and just say there is absolutely no data whatsoever to indicate it interferes with fertility, and here's why. Because we vaccinated, 100 and some odd million people, and they're all, the women are getting pregnant just like they were before.
Still babies.
There's still babies coming out. There's still babies coming out. Right, exactly.
Some of the communities that Jamie and I, interact with wonder about the possibility of a booster shot. Like, I know that people use that word casually, but do you think that that is something that's in our future?
I think it will be in the future of certain people, and they're going to be either elderly, people with underlying medical conditions, particularly people, transplant recipients, people with autoimmune disease. They may need to get a boost earlier than a normal, healthy young person who's doing fine.
What I am seeing now, though, are a lot of family members, particularly parents, coming in and asking me like, hey, doc, what do I do for my child? I've got the vaccine, my partner's got the vaccine, but they now are recommending that 12-year-olds can be vaccinated. How do you recommend, or how do you talk that through with a 12-year-old?
Yeah.
He's got kids, you've got children. My dad's waiting on some kids for me at some point, but how do you narrate that conversation?
That's a good point. We are finding that many young kids, they're encouraging their parents to allow them to get vaccinated. They really are, because they understand that vaccines, since the time they were little babies, have protected them against all the things you want to be protected against: measles, mumps, rubella, pertussis. The entire field of pediatric medicine has been completely transformed by vaccines. And I think when young kids understand that, they're more amenable to getting vaccinated against this disease that, that's one of the calling cards of the president's vaccine implementation program, is employing trusted messengers in the community core, including the barbershop beauty salon group is part of the trusted messengers.
Now, Dr. Fauci, if and when we get to DC, my man Atalo has a question for you.
So I love working in barbershops. Jamie and I, we frequent barbershops. If we're sitting in that barbershop, either in DC or South Central LA or Detroit, places that have flourishing communities, you're with us and they turn to you and they say, hey, we want to hear from you. What do you say to those patrons, to those community members, to get them to have a little bit less hesitancy and maybe consider the vaccination?
Yeah, well, the first thing I want to hear from them, I wouldn't preach to them. I want to say, hey, tell me what's up. What's going down? Why are you hesitant? I want to hear from you. And let them spill it out. And then we just engage in an equal conversation. Like, I'm not smarter than you, you're not smarter than me. Let's just talk about it. So that's what I would do.
You let the Brooklyn out a little bit on them, right?
Yeah.
I just want to say this has been an honor.
My pleasure.
Been an honor. We really appreciate you being on today's special episode of Barbershop Medicine.
What we're doing today is going to literally carry itself. It's going to have wings. It's going to run. And I'm so proud to be able to have this conversation.
Thank you very much, Jamie Atalo. It's great to be with you guys. Thanks for having me. And thanks for being on the front line. You guys are the heroes. Take care.